Although dental caries is the most prevalent chronic disease on our planet, affecting more than 90% of the population, the impact of oral diseases on the general quality of health is largely underestimated. As a result, oral health is generally marginalized from public health care all over the world. Tanzania is no exception. In this East African country that has a gross domestic product of $22.43 billion, American aid has focused primarily on malaria and HIV/AIDS. While these health issues need to be dealt with, oral health care has not yet been addressed systematically. Generally speaking, Tanzanians do not visit the dentist for cleanings and checkups. Rather, they come as a last resort when they have an abscess or experience extreme pain. Large jaw tumors, no longer seen in the USA, are common. Tanzania also faces a shortage of dentists and dental therapists to treat its 42 million people. The 200 dental clinics are poorly equipped and difficult to access for most Tanzanians, 74% of whom live in rural areas. In fact, most people can't afford transportation to get to the dental clinic, let alone pay for the fee for the government-subsidized service, which often amounts to more than a family's weekly wage. MCW recognized this challenge 10 years ago when it began facilitating dental outreach programs in the densely populated area of Arusha and then in rural Songea, where we built the Liana Cohen Dental Clinic in 2005. In just a decade, MCW has directly affected the lives of more than 10,000 children and youth in Tanzania. Most recently, in November, we teamed up with 2 Crown Council Smiles for Life dentists for a week to repair equipment at the clinic and to treat 70 patients and perform 121 procedures. Still, Tanzania cannot depend on short-term solutions alone to address the population's oral health care needs. Under the visionary leadership of President Jakaya Mrisho Kikwete, the Tanzanian government now recognizes the need to address oral health care systematically. The mission of MCW's Oral Healthcare Program has also evolved to achieve lasting oral health improvement in Tanzania. We make this happen by bringing private sector partners from around the world together to pool together and leverage their shared resources and expertise to make a difference. Today, MCW works closely with the Ministry of Health and Social Welfare and the only dental school in Tanzania, the Muhimbili University of Health and Allied Sciences, or MUHAS, to create a sustainable oral healthcare system across the country.
The equipment that has been brought by the miracle corners of the world has really changed. The services being offered now are better. We can cater for large numbers of patients as compared to the other times. And I give my credits to the miracle corners of the world for making this possible.
We thank the MCW, they've made a difference. Like, at least we see more people. That means more people are coming to seek oral health care. So MCW have really made an effort and a change in establishing oral health care in our country. I've been working with oral infection control program, together with the help of different people like Colgate and Palmolive branch from East Africa, that they really helped us facilitate this program.
Our approach is an integrated and holistic one, where we work on a number of tracks. Here are some highlights from the last year. In July, we partnered with leading U.S. dental manufacturing and supply companies to assist Tanzania in building sustainable dental equipment support services through a Train the Trainer initiative. This 3-week training program brought 2 young equipment repair technicians to the U.S. for on-site training. Our goal is to continue to provide training and support to the technicians in order to help them maintain and repair the equipment that was donated to MUHAS in 2009 as part of a larger effort to renovate and upgrade the dental school. We also aim to provide them with the knowledge and skills to train future equipment repair technicians in Tanzania. Our concept is that if we can train 2 technicians, those technicians in 5 or 6 years can train another generation. As part of a second Memorandum of Understanding between MCW and MUHAS in October, MCW and Henry Schein team members shipped a 40-foot container filled with donated state-of-the-art dental laboratory equipment to Tanzania. Dr. Paulo Sarita, the former head of restorative dentistry at MUHAS, made a compelling argument on why MCW should assist with the refurbishment. He said that in 1984, when it was decided to move the dental laboratory from the Muhimbili Hospital to the dental school, the equipment, which dated back to the 1960s, was already outmoded. In February, Henry Schein and MCW team members traveled to Tanzania to help MUHAS with the needs assessment and to coordinate donations valued at almost $400,000 from more than 30 international dental laboratory and equipment manufacturers. Today, MUHAS has a newly painted, air-conditioned, and equipped dental laboratory that is outfitted with benches built by Tanzanian craftspeople. MCW shares the vision of the Health Ministry and MUHAS to turn the lab into Tanzania's premier national dental laboratory and to become a regional center of excellence that provides Tanzania and its neighbors with dental appliances and prosthetics.
The fact that MCW has already equipped the dental school with all of the equipment and has built credibility with all of the stakeholders, we really are uniquely positioned to put a plan and a strategy together that's going to make a difference in the way oral health care is delivered all over Tanzania.
What MCW has achieved in cooperation with its international and Tanzanian partners in just a short period of time has demonstrated that we can have an impact on the quality of life and well-being of Tanzanians. Still, a lot of work needs to be done, and we hope we can count on you for your continued support.